Again, it's Dr. Rachel Brown, Medical Director of Prevention and Wellness with Business Health Solutions at Prisma Health. And this is our weekly COVID and wellness update. So as always, please remember that information is changing very, very quickly. Please check the date of this webinar. I am giving you this information on January 29th. So even by the time of posting, there may be some differences. You can always go to our Creating a Safer Workplace page or our Prisma Health COVID-19 vaccine page to get the most up-to-date information. And I'm going to pull up those resources in just a moment to show you what they have to share and say. However, let's start with our status update as always. So we're up to 435,633 cases of COVID in South Carolina. The percent positivity over the last 2 weeks has been 24.4%, which is great. That's going down. That's wonderful. Yesterday it was 25.3, but overall that percent positive is going down. We saw a bit of a plateau. Now we're starting to see the numbers decrease. In Greenville, when we look at incidents, we've got reported 1,286 cases per 100,000 folks. That's way down from last week. They have a percent positive of 28.7%, which is also way down. You may remember they had gotten up to about 38% positives. In Oconee County, they're seeing about 1,209 cases per 100,000 people. That's also slightly down. Their percent positive is hovering around the same number, though, as last week, and that's 32.7. In Richland, there are 887 cases per 100,000, slightly down. Percent positive is also remaining steady at 19.3. And then finally, Sumter unfortunately had a little uptick in their cases. Their incidence is 942 cases per 100,000 with a slight uptick in their percent positive to 24.3%. But overall, across the state, we are starting to see declining numbers, which is really encouraging. They are most likely due to the fact that folks have stopped traveling because of the holidays and stopped having large gatherings because of the holidays. That goes to show you that those are the kinds of things that are going to increase the number of infections. We still need to practice precautions. I know we are weary and tired of wearing masks and staying socially distanced and not having gatherings and washing our hands and paying attention to all of those things that we've been talking about over the last 11 months. But these are the precautions that are going to get us past this pandemic, plus our vaccine. So let's talk about the vaccine. Who is being vaccinated right now? We're still in phase 1A. I'm going to stop to share my screen, excuse me, so I can bring up some resources for you because we get a lot of questions. 1A we know is healthcare workers and folks over the age of 70, but there are some permutations even within those categories. So let me share with you some resources that can be very helpful. First, foremost, I'd like you to take a look at our Prisma Health COVID-19 vaccine page. It is constantly being updated, and it's going to be where you and your employees, family members, friends, community members, neighbors can find the most up-to-date information. I am still talking with folks who don't have any idea where you can get a vaccine, who's getting vaccinated or vaccinated now. All of that information is here. Our marketing folks are working overtime to make sure this is up to date. So you can see it lists the phase 1A and individuals who are over 70 as eligible for the vaccine. You can push vaccine request, fill out the form, and if you are eligible, Prisma Health will enter you into the VAMS service and issue an invitation for the vaccine. There are going to be some changes on the horizon starting next Monday, so February 1st. You may be watching this after February 1st. Prisma Health System for scheduling and documenting vaccines will actually be through our electronic health record, Epic and MyChart. If you happen to already have, or your employees already have, a MyChart account, they will be able to schedule, change, and cancel vaccine appointments through that portal. Also, our vaccine sites themselves are places where folks who may not be tech savvy or who are uncomfortable or who are having trouble with registration can go and work with our folks there who can get you registered and get an invitation issued or scheduled, excuse me, for a vaccine. I also want to point out that we have a Find a Vaccine site. So let's click on that and see what happens. When you click on Find a Vaccine site, it's going to list all of the Prisma Health vaccine sites, whether they have the ability to accept walk-ins or not, or whether they are requiring an appointment. So you can see here that the Kmart Plaza today is not accepting walk-ins, okay? But the Gamecock Park site is. This changes every day depending on vaccine supply. So please come to this site before you go to a vaccine site, especially if you plan to be a walk-in, to find out if those sites are taking walk-in appointments. These sites, not all, most of these sites, even if they're not able to vaccinate you because they're only taking the scheduled appointments, can also register you. So again, if you have an elderly parent or neighbor that doesn't have an email or doesn't know how to navigate the system, the VAM system and the Prisma Health system, then take them to one of the sites and we'll get them registered and scheduled. Not a problem. Let's go back to the vaccine site. And you can see as you scroll down, there's information about folks who either do not feel comfortable registering themselves or do not have access, do not have a computer or Wi-Fi. You can get help here. It goes into details around how you can volunteer for vaccine sites. And then finally, a very loose timeline. This also is changing, so be aware that the governor makes announcements around when phase 1B will open and beyond, and we will be mobilizing the moment we hear about that. Some of your most common questions are at the bottom of the page. So many answers here, so much information. Please share this with your employees. So many of the concerns you have are addressed on this page. Of course, if you don't get the information that you need on this page, please visit our Creating a Safer and Healthier Workplace page. If you scroll down, you can find not only access to the webinars that we're doing each week, but how you can reach us and schedule a consultative appointment, or even just email us and I'll email you back with the answer, or one of our team members will. Okay, so visit our Prisma Health Creating a Safer Workplace page to reach out to us for questions that aren't answered otherwise on our website. I'd like to take you to the South Carolina DHEC page. This is the COVID-19 vaccine page, and it has so much useful information. I'm going to scroll down first to show you the current list of who is eligible for vaccine. So we mentioned over 70 years of age already. And of course, we know healthcare workers and first responders are being vaccinated. But look at this list. Many, many other folks in those fields that you may not have realized. So you want to take a look and make sure that someone is maybe on this list that they weren't aware of. The most recently added category is here: home caregivers for children who are medically fragile or who have very complex medical statuses and situations. There is a form that needs to be filled out in order to get those home caregivers vaccinated, but they are part of 1A right now. So the next question I get is usually, well, okay, they say that over 70-year-olds can be vaccinated in South Carolina, but I heard in another state they're vaccinating folks who are 65 and older. Please understand that each state's eligibility criteria are dictated in consultation with Operation Warp Speed and the governor of that state. So right now in South Carolina, Governor McMaster has said that only 70-year-olds and older can be vaccinated. So there are some states where it's 75 and above. It's just dependent on each state's supply and who they're trying to target first and reduce risk the most in. The next question I usually get is, okay, what about 1B? When is 1B going to start? And I got to tell you that depending on the source, this timing changes every time I ask the question. So I've heard as early as a couple of weeks. I've heard as late or as vague as early spring. So the short answer to the question of when is 1B going to start is we don't know yet. But what I can tell you is that Business Health and Prisma Health have been working behind the scenes to be ready to go when phase 1B begins. Let's scroll down a little farther on this DHEC page, and you'll see here that already since last week, they've been modifying who's in 1B. As I've mentioned to you before, I think we can all anticipate that once 1B opens, that we will have a list similar to the 1A list right here that tells us exactly who's in 1B. Right now, there's a list here that's a little bit specific, but still fairly general. Many of you will be looking at this manufacturing workers category. And then we've got frontline essential workers who are considered at highest risk of exposure to COVID. We're not sure exactly what that means and how we're going to determine who those folks are yet. But the good news is that we're all starting to think about who is at highest risk and moving them into that 1B category so that it isn't just based on occupation, that it's based on risk. And so we will be getting more information from Operation Warp Speed and DHEC and Prisma about who that is when that opens up. Now, the next question I usually get is, okay, I'm in 1A or I'm in 1B, and when that opens, how do I get my vaccine? Well, there are several ways right now if you're eligible currently, and there are so many more ways in the pipeline that are coming. So right now, as I mentioned and showed you from our website, there are numerous Prisma Health vaccine sites for our community members. So if you are on the list of 1A eligible community members, or you are older than the age of 70, please submit a vaccine request, okay, so that we can get you on the schedule and we can vaccinate you. As you noticed, there is opportunity for walk-ins. So if you do walk in and you are, for instance, over 70 years old, and we are accepting walk-ins that day, we will, or drive-ins, if it's a drive-through, we will vaccinate you. That process may take slightly longer than if you had an appointment. And certainly if we run out that day, then we will not be able to give you a vaccine, but there is the opportunity for walk-ins. The other thing you can do, I'm going to scroll to the top of the DHEC page and show you this Find a COVID Vaccination Location. Last week, this was taking us to a map. We'll see where it takes us this week. They had mentioned last week, DHEC had mentioned that they were trying to improve their vaccine locator. So let's see if that's happened. We'll give it a second. And while we're waiting, let me mention that what you'll see on this map or on this vaccine locator are, yes, here we go. Here's the map. Are the sites that have been certified as vaccine administrators. The green sites are sites that have vaccine and are ready to give them. However, please remember that on a given day, the vaccine supply may not be available. So be sure to check before you visit. Now, for instance, here you see the Publix pharmacy. So there are Prisma Health sites, but there are also 2 retail pharmacies that are giving vaccines, and that's Publix and Ingles. Understand that CVS and Walgreens are now incredibly busy using the Moderna vaccine to vaccinate folks in long-term care facilities and the staff that work at those facilities. Once that is completed, other retail pharmacies, CVS and Walgreens and others, will begin giving vaccine to other community members as well. But right now, it's just Ingles and Publix in South Carolina. So let's go back to our Prisma Health vaccine page. And actually, I'm going to stop sharing my screen at this point so I can talk to you. So those are the two ways, or the multiple ways you can get an appointment for a vaccine now if you're eligible. But here's what's coming down the pike, okay? This is exciting. Let's talk about additional vaccines first. So some of you may have heard that Johnson & Johnson may be just a few weeks away from getting their emergency use authorization. Johnson & Johnson's vaccine is a viral vector vaccine. So it's different from Pfizer and Moderna, which are mRNA vaccines. It is also a one-dose vaccine, which is very different and will mean some really nice logistical changes in terms of tracking who's been vaccinated. You've probably also heard that Johnson & Johnson's vaccine is 66% effective compared to 95% effective with the Moderna and the Pfizer vaccine. Please understand that that is still highly effective, okay? What's really interesting about the Johnson & Johnson vaccine is the data is starting to reveal that it is 85% effective at preventing serious illness and hospitalizations, okay? So while you may be thinking, well, I don't want COVID at all, and certainly none of us wants COVID at all, the fact that this can prevent serious illness and hospitalizations at such a high rate should be taken very seriously. And so if you are not able to get the Moderna or the Pfizer vaccine, the Johnson & Johnson vaccine, when it comes out, will be a really, really solid alternative because it will keep you, there's a high rate of efficacy and keeping you from having severe disease. Okay, so that's really important to understand. The AstraZeneca vaccine is also in phase 3 trials. No recent change or word on when they may apply for emergency use authorization, but they're right there in line with Johnson & Johnson. The other changes that are coming are more sites. Okay, so even though right now we are just in phase 1A, we understand that when we go to phase 1B, that is going to mean millions more folks eligible for this vaccine. So Prisma Health, DHEC, and all the other healthcare organizations are working very hard to figure out how to offer more access. So we are looking, Prisma Health is looking at more mega sites. We have the mega site at Gamecock Park right now, as well as one in the old Kmart location in Greenville. But we're looking at more setups like that. As I mentioned, the retail pharmacies will eventually also be giving vaccines to community members, and Prisma Health's pharmacy sites are also looking to set up to become vaccinators. We have numerous, I think around 10 pilot ambulatory care sites, so primary care practices across the state that we want to stand up to be able to give vaccines. And Prisma Health is looking very diligently into strategically choosing practices that are throughout our state to provide access to folks that may have a hard time coming in to the main sites in the downtown areas. Of course, Business Health is working to be ready to help you and collaborate with you to set up on-site business COVID vaccine clinics, much like we do with our flu clinics. We are waiting on a lot of variables. Which vaccine are we going to be able to offer you? Obviously, Pfizer would be a very difficult vaccine to transport because of the ultra cold storage. But if we do get Moderna available to us after it's used for long-term care facilities, that would make it a lot easier. What about the Johnson & Johnson vaccine? So many questions to be answered, but that's what we're working on right now in anticipating the opening of phase 1B. And we also have mobile units. An entire team at Prisma Health is diligently working to scatter mobile units across our state, focusing on bringing that vaccine to folks who have less access, so rural or underserved areas. And they have already spoken with us about collaboration. So these are all going to be wonderful ways to increase that access to the vaccine. One more thing that's on the horizon, DHEC has mentioned to us that, not sure when this is going to happen, but that they're working on what's called a self-enrollment portal. so that folks can log on themselves and find out their eligibility and schedule appointments instead of having to work through healthcare organizations like us. However, in the meantime, we are still happy to do that for you. Currently, we have organizations, businesses that reach out to us. If they're in the 1B category, we go ahead and have you fill out the spreadsheet, which we will hold on to and then submit to VAMS when it's time to schedule your appointments. As we move, as I mentioned before, to this new system with the Epic electronic health record at Prisma Health, that may look a little different, so keep your eyes and ears open, or simply contact us and ask questions about how that process may look different. But we want to help you get registered as easily, and your employees as easily as possible. Let's talk a little bit about vaccine hesitancy. So as we get closer and closer to your organization possibly being eligible for vaccination, you're going to start wanting to look around at who is interested in getting the vaccine. And for those that are not interested or who have concerns, we want to honor that by talking about this, by being open and transparent about the vaccine, its safety, and its efficacy, but understanding that there may be a multitude of reasons why someone is hesitant around getting that vaccine. So here are some things that you can do. Like I said, address it head on, begin talking about it now. And then find out, try to understand where your workforce is coming from, or pockets of your workforce, or individuals within your workforce. Prisma Health has developed, or excuse me, Business Health with Prisma Health has developed a survey that can help you do that. So if you're interested in using this survey, please reach out to us. And when it is ready to be kicked off, we will give you access to that. So you can find out who in your workforce has some questions, has some concerns. You also want to make sure you're able to provide education. If you don't feel empowered to provide that education, that is what we are here for. Reach out to us so that we can do that for you. Watch these webinars. Use our Prisma Health COVID-19 vaccine page so that you have the best information and you're armed with that knowledge that you can share with your employees to get rid of some of those concerns and questions. And then finally, consider incentivizing getting the vaccine. Now, be careful. I personally do not recommend that we do anything that would seem like a punishment to those who did not get the vaccine, but certainly making getting the vaccine fun and rewarding, and maybe even getting treated to a little something because of that may help some folks be a little more motivated to go get vaccinated. All right, a lot of folks are asking me about the variants, the virus variants. And let me start by saying two things. One is we anticipate mutations in viruses every season. This is not unusual. This is what viruses do. But let me tell you the other side of that coin. They do this when they have a high rate of transmissibility, okay, or a high rate of infectiousness, and have the opportunity to move from human to human, from vector to vector. So it is because we are not all wearing masks that some of these mutations occur, okay, because we continue to infect each other and those opportunities for mutation occur. This is yet another reason why it's important to wear a mask. The more of us that wear a mask, the less likelihood of mutations, okay? Now, some of this can't be helped. Obviously, you've heard that mutations are coming from different areas of the planet. That's to be expected. What we want to know is not why did this happen? We know that. But what does this mean? What does this mean for testing? And what does this mean for the vaccine? So I can tell you that CDC and other scientists are hard at work making sure that our tests are still picking up COVID regardless of the mutation. So you're going to hear more and more information about that. In general, PCR tests will do that. The rapid tests, we're not sure yet. We're looking at that data, but so far all signs point to encouraging data that yes, our testing is picking up even the variants. More importantly, or I think I get asked more often, what about the vaccine? Is it going to be effective against other mutations? A preliminary evidence shows that absolutely it is, that the mutations have not impacted the efficacy, but there's more good news behind that information, and that is that these mRNA vaccines lend themselves to adaptability, meaning that the manufacturers of the vaccine can actually tweak the vaccine delivered by that piece of mRNA, or excuse me, the protein delivered by that piece of mRNA, so that it can be effective against any mutations. Okay, so all of that is being looked into right now. It's all very, very encouraging. Doesn't change our course in the least, except to reiterate that wearing masks is so important still. And then finally, let me talk to you about precautions in quarantine, or excuse me, around testing in quarantine. You may have noticed there's some new testing recommendations for travelers. Certainly, international travelers have to be tested before they can enter the US. It is recommended that folks are tested before traveling internationally, excuse me, 2 to 3 days before they travel, and then be tested again when they come back 3 to 5 days after they travel. That's not including the test you need to get back into the country. But it just makes sense that if you're traveling internationally or otherwise, that you continue to mask, you continue to socially distance, okay? And that when you get back from your trip, you think about decreasing your amount of exposure for 14 days after you return. Okay, not necessarily strict isolation, but really just being conscientious about your exposure for 2 weeks following return. Please remember that for folks who are exposed to people with COVID-19, there are now 3 quarantine strategies. The first is the one that's always been around, and that is to quarantine for 14 days. And it, of course, is the best strategy if you're trying to mitigate further spread and outbreak. There's a second strategy, and that is to quarantine for 10 days. It has a slightly higher risk of spread, but still within very safe parameters. And then the third strategy, which most folks are using now because it's much more user-friendly, it's more easy to comply with, and that is the 7 days of quarantine with a negative COVID test on the 5th day. Okay, so you get that COVID test on the 5th day, whether it's given to your result is given to you on day 5, 6, or 7, you still quarantine until day 7 and can come out of quarantine if that test is negative. Believe it or not, that still incurs a slightly higher risk of spread over the 10 or the 14-day strategies, but it's still low enough that we feel like it's a good mitigation for outbreaks. And finally, I've had a couple of questions from that harken back to way back when. How long does someone need to isolate when they have been diagnosed with COVID-19? Folks, this recommendation has not changed. It is still 10 days, and it does not matter if you have 10 days worth of negative tests, you still isolate for 10 days. A negative test at day 5, 6, 7, 8, 9 does not release you from that 10-day isolation period. Please, let's try to stick to those quarantine and isolation protocols, to all of our precautions, so that we can get on the other side of this pandemic. Reach out to us if you need us to help educate your workforce or answer questions so that we can manage vaccine hesitancy and get folks vaccinated in large numbers as quickly as they're eligible. And remember that we're now approaching 7,000 deaths. That's 1,000 more than I reported last week. We can prevent this. We just need to do the work of it. As tired as we are, we're going on a year. We just need to do the work of this and buckle down and get through this last tumultuous spring. Okay? We're here to care for you so you can care for your workforce. Reach out to us with any questions. We'd love to hear from you, and I will see you next week.